This video will be on appendicular muscles, the lower limbs, and girdle. I'm Jenny McFarland. So first we have the iliopsoas, which consists of the iliacus and the psoas major. Two closely related muscles fibers pass under inguinal ligament to insert into femur via common tendon. Iliacus is more lateral. The origin for the iliacus is the iliac fossa and crest and the lateral sacrum. For the psoas major, it is the transverse processes, bodies, and discs of T12 and lumbar vertebrae. The insertion on and just below the lesser trochanter of the femur for both muscles. And as you can see in the picture, the iliacus is the one that looks more directly on the pelvis, and it is more lateral. And the psoas major is the longer one going up towards the vertebral column. The action, the iliopsoas are a prime mover of thigh flexion and flexing trunk on thigh, as well as lateral flexion of the vertebral column for the psoas, which makes sense because as you can see, the psoas are connecting to the vertebral column. Here we have a bone where you can see the iliac crest, as well as the iliac fossa, where the iliacus is originating from, and the sacrum. Alright, here we have a thoracic vertebrae, and you can also see a section of the vertebral column, as well as the transverse processes. Here we have the femur, where you can see the lesser trochanter kind of at the bottom of that crescent shape. Here we have a model because these muscles, their location makes them hard to see from this angle, but I circled the general area, as you can see, by the pelvis, and you can kind of see the bones. And here's a cool picture where we can actually see the muscles in thigh flexion, which the iliopsoas play a part in, of course, as we just went over. And here we can see flexion of the vertebral column, which, as we said, the psoas also play a part in, as they have an origin there as well. Next we have the adductor magnus, one of the three medial adductors. It is a large muscle mass forming medial aspect of thigh, arises from front of pelvis and inserts at various levels on femur. So the origin is the ischial and pubic rami and ischial tuberosity. The insertion is the linea aspera and adductor tubercle of the femur. So adductor tubercle, that is helpful to remember. The action for this one, it of course adducts, and it also medially rotates and flexes the thigh. It is also a synergist in thigh extension. Here we have a pelvis, so you can see the area of the pubic rami and the pubic symphysis and the ischial ramus and ischial tuberosity. And then we have the femur, where you can see the linea aspera, as well as the adductor tubercle. Here we have a model, and again, this is a very medial muscle. It's kind of hard to see, but it's located by the gracilis underneath the gluteus maximus. And here we have a diagram that both shows the flexion of the thigh as well as medial rotation, same thing as internal rotation, but towards the midline, and adduction as well. Next we have the biceps femoris, which is the most lateral muscle of the group, and it arises from two heads, as the name biceps would indicate. The origin is the ischial tuberosity for the long head and the linea aspera and distal femur for the short head. The insertion for this one, the tendon passes laterally to insert into the head of the fibula and the lateral condyle of the tibia. So you can see that in the picture. It goes down kind of between the two. The action, the biceps femoris extends the thigh. It also flexes the leg and laterally rotates the leg. Here we have a pelvis so that you can see the ischial tuberosity. Here we have a femur, so once again you can see the linea aspera on this. Here we have the fibula and the tibia, so you can see the head of the fibula as well as the lateral condyle of the tibia. We have a model showing the back of the thigh where the biceps femoris is located. We have a diagram where you can see the different actions, and so it's interesting to note that while the biceps femoris can extend the thigh, it can also flex the leg, and it laterally rotates the leg, so being able to do extension and flexion, it's acting on different joints and both. Next we have the rectus femoris, which is a part of the quadriceps group. It is a superficial muscle of the thigh, when straight down thigh, only muscle of the group to cross the hip joint. The origin is the anterior inferior iliac spine and superior margin of the acetabulum. The insertion for this muscle is the tibial tuberosity as well as the patella. And as you can see, I will outline this one. This kind of has the whole quadriceps group in green. The action for this muscle, it extends the leg and flexes the thigh. So again, that's kind of acting on different joints and areas. Here we have part of a pelvis, so you can see the anterior inferior iliac spine as well as the acetabulum. Here we have a patella, which is pretty self-explanatory and easy to identify. Here we have the fibula and the tibia, so we can see the tibial tuberosity. Here we have a model. You can see the anterior portion of the thigh where the rectus femoris is located. Again, here's our diagram showing leg extension as well as the flexion of the thigh. It's got a lot of movements labeled here, pretty helpful for those. Next, we have the sartorius, which is the longest muscle in the body. It is a strap-like superficial muscle running obliquely across the anterior surface of thigh to knee. The origin is the anterior superior iliac spine, and the insertion is by an aponeurosis into the medial aspect of the proximal tibia. And this picture kind of shows the action that it allows you to do. The action of the sartorius, it flexes, abducts, and laterally rotates the thigh. It also flexes the leg, and it is known as the talar muscle because once again, as the picture kind of shows, this muscle allows you to cross your leg or prop your foot up on your other leg. Here we have a part of a pelvis where you can see the anterior superior iliac spine, which is a point of origin for the sartorius. Here we have our fibula and tibia again so that you can see the medial side of the tibia. And here we have a model. Again, this is one of my favorite muscles to identify because you just gotta look for the long strap-like one going across the thigh. Here we have our actions again, so you can see flexion and abduction and external or lateral rotation. So this muscle is helping us with a lot of things. Next, we have the tensor fasciae lata or tensor fasciae latae, depending on how you want to say it. This is enclosed between the fascial layers of the thigh. The origin is the anterior aspect of the iliac crest and the anterior superior iliac spine. The insertion is the iliotibial tract, which is the lateral portion of the fascia lata, It's often referred to as the IT band. The action for this muscle, it steadies the trunk on the thigh, and it also flexes, abducts, and medially rotates the thigh. So this, even though it doesn't look super large or anything, it's pretty important. Once again, we have part of a pelvis that you can see the interior aspect of the iliac crest as well as the anterior superior iliac spine. So here we have a model, and this is kind of difficult to see, but you can see that iliotibial tract and then the area above it, which would be the tensor fasciolae. And here we have our diagram showing flexion, abduction, as well as medial or internal rotation. Again, it's important to note that a lot of these muscles are moving both the hip and the knee joint. Next, we have the gracilis, which is another strap-like muscle. It's a superficial muscle of the medial thigh. The origin is the inferior ramus and body of pubis, and the insertion is the medial surface of the tibia, just inferior to the medial condyle. So this is just the muscle right on the medial side of the leg. So the action for this one, it adducts the thigh as well as flexes and medially rotates the leg, especially during walking. So this is a very important muscle. Here we have a part of a pelvis again, where you can see the pubic body as well as the inferior pubic ramus. Here we have our fibula and tibia again, so that you can see the medial surface of the tibia just inferior to the medial condyle. So again, this is a very medial and thin muscle, so it's hard to see without a good angle, but as you can see, the medial side of the thigh is where it is located. Here we have our diagram where you can see adduction, flexion, as well as medial rotation, and so we're internal rotation, and we're using this to keep our foot facing forward while we're walking as well. Next, we have the tibialis anterior, which has a pretty descriptive name. It's on the front of the tibia. It is a superficial muscle of the anterior leg, parallel sharp anterior margin of tibia. The origin is the lateral condyle and upper 2/3 of the tibia and the interosseous membrane. So if you remember your bone prefixes, so that you can figure out what that means. The insertion is by the tendon into inferior surface of the first cuneiform and metatarsal 1. So this one's going all the way down from the top of the tibia to the foot. The action for this one is a prime mover of dorsiflexion, so toes are going up and it inverts foot, so the foot goes inward and supports the longitudinal arch of the foot. Here we have a picture of the tibia and fibula again, so that you can see the lateral condyle. Here we have a foot, so you can see the metatarsals as well as the medial cuneiform and all of the cuneiforms. And here we have a picture that shows the arches, and you can see the green arrow indicates the lateral longitudinal arch, which is supported by the tibialis anterior. And here we have a model, and it's kind of hard to see, but it's coming over on the lateral side, going down to the foot. And here we have a diagram which shows dorsal flexion. So you can see the ball of the foot is going upward, as well as inversion, where you can see the bottom of the foot is turning inward medially. Next, we have the extensor digitorum longus. So the name is pretty descriptive. It extends the digits or your toes. It is a anterolateral surface of the leg. That's where it's located, and it's lateral to the tibialis anterior. The origin is the lateral condyle of the tibia, proximal 3/4 of fibula and interosseous membrane. The insertion, the tendon divides into 4 parts. And so it inserts into the middle and distal phalanges of toes 2 through 5. And as you can see in the picture, it kind of webs out at the bottom and goes towards the phalanges. The action for this one, it is a prime mover of toe extension, again as the name would imply, and it dorsiflexes the foot as well. Here we have a tibia and fibula so that you can see the lateral condyle of the tibia again. And then we have a foot so that you can see the phalanges, and again this would be the distal and middle. And then you can also see that the toes would extend. Here we have a model, and you can very clearly see the webs spreading out into the toes. And here we can see dorsiflexion, and it makes sense that the extensor torn would have a part in this because it is an extensive motion. Next we have the fibularis or peroneus longus, whichever you want to say. Fibularis is easier to remember probably. It is a superficial lateral muscle, overlies the fibula. The origin is the head and upper portion of the fibula, and the insertion is by long tendon, underfoot to metatarsal 1, and the medial cuneiform. The action for this muscle, it plantar flexes and everts the foot, so pushes it more outward. Here we have our fibula and tibia again so that you can see the head of the fibula as well as the entire fibula. Here we have the foot so that you can see the metatarsals, and you can also see the medial cuneiform. It is the cuneiform that is most medial on the foot, so that is pretty self-explanatory as long as you know if you're looking at right foot or left foot. Here we have a model. Again, it's kind of hard to see, but it is on the lateral portion of the leg where the fibula is. So here we have our diagram, plantar flexion, where the toes are pointing down, so you plant seeds down in the ground, and then eversion, where the bottom of the foot everts and goes outward. So that makes a lot of sense for the name. Last but certainly not least, we have the gastrocnemius, which is a superficial muscle of pair, and it has 2 prominent bellies. The origin is by 2 heads from medial and lateral condyles of the femur, and the insertion is the calcaneus via the calcaneal tendon or the Achilles tendon. The action for this one, it plantar flexes the foot when the leg is extended. It also crosses the knee joint and thus can flex the leg when the foot is dorsiflexed. So again, this is one of those that can act on multiple joints at once. Here we have the femur so that you can see the lateral condyle, and you can also see the medial condyle right there, just on the inside for this picture. Next we have a picture of a foot so that you can see the calcaneus or your heel bone. Here we have a model, and this is another one of those muscles that I love because it's very easy to identify. It's right there on the back of your lower leg. It's almost kind of shaped like a heart, and the soleus is located underneath the gastrocnemius, so if it was lifted up, you would be able to see the soleus there also. And here we have our diagram where you can see plantar flexion again, which the gastrocnemius is involved in. You can't see the flexing leg with it, but it can flex the leg when the foot is dorsiflex, but it does not dorsiflex the foot, and this is what we use for calf raises also. Thank you for watching. I hope that this video was informative and will help in learning the insertions and origins for these muscles.